Hi everyone, my name's Lauren and I'm a senior physiotherapist here at Dunshaughlin Physiotherapy and Sports Injury Clinic. Welcome to the final week in our pregnancy related video series. This week I'm going to be talking about returning to exercise after pregnancy. I'm going to include some helpful tips and advice along with some exercises to help you strengthen your core and your pelvic floor muscles to prepare you for returning to exercise.
This is a really helpful infographic showing you examples of exercise progression in the weeks following delivery. In the first 2 weeks, it is perfectly safe and is advised to start gentle pelvic floor and tummy muscle activation exercises along with deep diaphragmatic breathing. It is also good to do some gentle walking to get you moving, but you also want to focus on resting and recovering in this stage too. After this and up to 6 weeks, you can gradually increase your walking time, and if you feel comfortable, you can start adding in gentle bodyweight exercises such as squats, lunges and bridges. You can start doing some low impact exercise such as cycling or using a cross trainer if you feel comfortable. After 12 weeks, it is safe to start higher impact exercises such as running, anything that involves jumping, and increasing any weights that you might be using when you're doing any weightlifting. Before this, you want to avoid these to allow your pelvic floor time to recover and strengthen up. Here are some simple core activation exercises to get you started. Starting with deep core and pelvic floor activation. Lying on your back with your hands on your stomach. When you take a deep breath in, you should feel your hands rising up as your stomach expands. As you breathe out, your tummy should fall again. But I want you to think about actively squeezing your pelvic floor muscles as if you're stopping wind and thinking about drawing your lower tummy muscles in towards your spine. And then you can relax and let go as you take a breath in and repeat as you exhale. You can practice this 10 to 15 times in lying, sitting and standing to get your tummy muscles and your pelvic floor activating properly. The next exercise is a simple glute bridge. This is for your glute muscles at the back of your hips. So what you want to do is start by lying on your back. Taking a breath out, you want to engage your tummy muscles and your pelvic floor as shown before. And you're going to tip your pelvis back, slowly rolling up into your shoulder bridge, squeezing the glute muscles at the back of your hips. Pause for a moment and slowly roll back down. You want to repeat this again 10 to 15 times just to get your glute muscles activating. The next exercise is on your hands and your knees. So your hands should be underneath your shoulders and your knees underneath your hips. You want to start by having a nice neutral spine and taking a breath out. You want to again engage your tummy muscles and your pelvic floor. As you do that, you're going to straighten out your opposite arm and opposite leg, trying to lengthen it away from each other, trying to keep your spine as neutral as you can. Pause for a moment and return back to the middle. Take a breath in and exhale and repeat again, switching sides. Start with 5 repetitions each side and gradually build that up to 10 or 15. The last exercise is a simple stretch for your hip muscles. So lying on your back, you're going to cross one ankle onto your opposite knee. You're going to pull that knee into your chest, crossing your hands underneath behind the thigh. You just want to give that a gentle pull towards you until you feel a little bit of a stretch in that hip muscle. You want to hold that for 15 to 20 seconds and switch sides. After you do some exercise, you can use any of the stretches that I showed you in some of the previous week's exercise videos just to help keep your back and your hips nice and healthy as you're returning to exercise.
It's important to remember that if you have pain anywhere, are leaking urine when you exercise, or have feeling of heaviness in your pelvic floor, that this is not normal and is something that can be addressed. And I would urge you to contact a women's health physio in your area to get fully assessed. I really hope you enjoyed our pregnancy related video series. If you would like any more information, please comment below and we will get back to you.